Have you ever noticed that your feet are always cold even when everyone else feels perfectly comfortable? Maybe you wear socks to bed. Maybe your feet feel like ice while the rest of your body is warm. Or perhaps your partner keeps asking, why are your feet always so cold? Most people assume it's nothing serious, but sometimes cold feet can be your body's way of telling you that something isn't quite right. It could be something harmless, or it could be an early sign of a medical condition that needs your attention. Today, we are going to explore the 10 most common reasons why your feet are always cold, what symptoms to watch for, and when it's time to see a doctor. So let's dive in and dig into the video. Number one reason, you are simply cold. Let's start with the most obvious explanation. When you are exposed to cold weather, your body naturally reduces blood flow to your hands and feet to preserve heat for vital organs like your heart and brain. Now, this is completely normal. If your feet warm up once you are indoors or wearing warm socks, there is usually nothing to worry about. But if they are cold all the time, even in warm weather, keep watching for that signal. Number two reason could be because of poor blood circulation. Now, one of the common medical causes is poor circulation. When blood doesn't flow efficiently to your legs and feet, they receive less warm blood. This can happen because of narrowed arteries, smoking, diabetes, or simply reduced physical activity. You may also notice the following: leg pain when walking, or slow healing wounds, or weak pulses in the feet, or shiny skin or hair loss on the legs. Now, poor circulation should never be ignored because it may signal peripheral artery disease, which also increases your risk of heart attack and stroke. Number three reason is diabetes. Many people know diabetes can damage the eyes and the kidneys, but fewer realize it can also affect the feet. High blood sugar can damage nerves, a condition which is known as diabetic neuropathy. And some people experience the following symptoms: cold feet, burning pain. They may experience tingling sensation, numbness. They may experience reduced sensation. And even if your feet feel cold, they may actually be warm to the touch when you have diabetes neuropathy. And that's because the problem is in the nerves, not necessarily the temperature. If you have diabetes, regular foot checks are extremely important. Number four, hypothyroidism. Now, your thyroid gland controls your body's metabolism. When it's underactive, everything slows down, including heat production. Besides cold feet, you may notice the following symptoms: constant tiredness, weight gain, unexplained weight gain, or dry skin, hair loss that happens all of a sudden, or constipation. Feeling cold all the time could be another symptom. A simple blood test can diagnose this condition, and treatment is usually very effective. The other reason number five, is anemia. So if your body doesn't have enough healthy red blood cells, less oxygen reaches your tissue, and this can leave you feeling cold. When less oxygen is reaching your tissues, it can leave you feeling cold. Anemia is common in women with heavy periods. It's also common in pregnant women. It is also common in people with poor nutrition, in individuals with chronic illnesses. Other symptoms include fatigue, dizziness. Some people may present with pale skin. Others may present with shortness of breath. Now, fortunately, anemia is treatable. Once the underlying cause is identified, anemia is treatable. Number six is what we call Raynaud's phenomenon. Now, some people experience sudden episodes where their fingers or toes turn white, then blue, from white to blue, then to red. This condition is called Raynaud's phenomenon. Perhaps you might have come across this word. And cold weather or emotional stress can trigger this condition. The small blood vessels temporarily narrow, therefore reducing blood flow. Most cases are mild, but severe or frequent episodes should be assessed by a healthcare professional. Number 7 is smoking. Now, smoking damages blood vessels through the body or throughout the body. It narrows arteries and also reduces blood flow to the hands and the feet. Even young smokers can develop circulation problems years before symptoms become obvious. Now, quitting smoking is one of the best things you can do for your circulation and your overall health. Number 8 is certain medicines. Some medications can reduce blood flow to the extremities. Examples of this medication include high blood pressure medication. We have migraine prevention medication or heart conditions, medication that are used in heart conditions. Now, this doesn't mean you should stop taking them. Never discontinue prescribed medication without consulting your healthcare provider. If you think your medicine is causing cold feet, discuss it with your doctor or your pharmacist. Have that discussion with them. Number 9 is stress and anxiety. When you are anxious, your body releases adrenaline. This causes blood vessels in your hands and feet to narrow temporarily. As a result of that narrowing, your feet may suddenly feel cold. Managing stress through exercise, through adequate sleep, through relaxation techniques or counseling can help you to reduce these symptoms. Number 10 is aging. As we grow older, circulation naturally becomes less efficient. Blood vessels become less flexible, and older patients often have reduced muscle mass, making it harder to stay warm. That's why cold feet become more common with age. However, don't assume aging is the only cause. Persistent or worsening symptoms should still be evaluated. Now, cold feet aren't always a medical emergency, but you should seek medical attention if you notice the following. If you notice severe pain, if you notice foot wounds that won't heal, if you notice your skin is turning blue or black, if you notice a loss of feeling, if you notice persistent numbness or fever with foot redness or swelling, one foot suddenly becoming much colder than the other is another signal. Now, this could indicate serious circulation problems or infection that requires prompt treatment and attention. Cold feet aren't always just cold feet. They aren't just cold feet. Sometimes they are perfectly normal. Other times, they may be the first sign of conditions such as diabetes, anemia, thyroid disease, poor circulation, or peripheral artery disease. The key is paying attention to your body and not ignoring persistent symptoms. If you've been struggling with cold feet for weeks or months, don't just keep buying thicker socks. Find out why. Do your feet always feel cold? I would love to hear about your experience in the comment section below. If you found this video helpful, please give it a thumbs up, share it with someone who is always complaining about cold feet, and subscribe for more evidence-based health information every day, every week. I'm Dr. Libeya Bethwell, and thank you for watching. Stay healthy, and I'll see you in the next video. Bye for now.